Welcome to the Depth Dive. Today, we're diving into the future of Australian healthcare, specifically how technology is shaping your experience as a patient. You sent over some really interesting research on this. The SOTI Code Digital Report, insights from the Australian Government Productivity Commission, and even CSIRO's work on AI.
Yeah,
Expert speaker ready to unpack all of this.
absolutely. Yeah, it's a topic with huge implications.
It really is. Let's start with something that impacts both patients and the healthcare system as a whole: outdated technology.
It's fascinating how technology is revolutionizing so many fields, yet Australian healthcare seems to be struggling with these legacy systems. And it's not just about, slow computers and things like that. It's about the very real impact on patient care and the financial strain on the entire system.
Yeah, the SOT report really highlights that, doesn't it? Healthcare staff losing an average of 4 hours per week per employee because of tech issues. That's like losing a whole day's work every week.
It is.
And when we're talking about healthcare, time is incredibly valuable.
Exactly, and the Australian Government Productivity Commission estimates that over $5 billion could be saved annually with better technology integration.
Wow.
Imagine $5 billion. That's, to put that into perspective, that's money that could be redirected to reducing wait times, funding vital research, or even making medications more affordable.
Yeah, it's almost like we're leaving opportunities on the table, opportunities that could directly translate to a better healthcare experience for everyone.
Yeah.
So, how do we bridge this gap? Telehealth has been mentioned as a potential game changer, especially for those in rural areas. Could you explain why that is?
Well, think about it this way. Telehealth has the potential to provide access to specialists no matter where you live in Australia.
Right.
Imagine a specialist appointment from the comfort of your own home, without the stress of travel and long wait times.
That sounds incredible, especially for people in remote areas who might not have easy access to specialized care.
Exactly. But the SOT report also highlights that legacy IT issues are creating a significant barrier. They found that a quarter of healthcare organizations can't even support telehealth devices remotely. It's like having a brand new state-of-the-art car, but no roads to drive it on.
Oh, wow. Okay, so it's about having the right infrastructure and support in place to truly harness the power of these new technologies. What's preventing healthcare organizations from making these necessary updates?
Well, it's a complex issue with a number of factors at play. Funding limitations are a significant concern, as is the inherent resistance to change that can be present in any large system. And, I think there might be a lack of awareness about the long-term benefits of fully embracing these new technologies.
It's clear that there are hurdles to overcome, but it sounds like the potential benefits are enormous. And it's not just about telehealth, right? The Productivity Commission's report also mentioned the role of AI and how it could potentially automate a significant portion of healthcare tasks.
Absolutely. Now we're talking about using the power of AI to analyze medical data, assist healthcare professionals in making decisions. Imagine, for instance, AI sifting through countless medical records and research papers to help doctors make faster and more accurate diagnoses. That could be a game changer, especially for complex medical cases.
So instead of replacing doctors, AI would actually be supporting them, providing them with additional insights to enhance their expertise.
Precisely. The Productivity Commission report suggests that up to 30% of healthcare worker tasks could be automated through AI and other digital technologies. Think about what that means, freeing up doctors and nurses to spend more quality time with patients, providing more personalized care, and really focusing on the human aspect of healthcare.
That sounds incredibly promising. And speaking of AI in healthcare, I'm curious to hear more about the CSIRO's work in this area. You mentioned they're doing some groundbreaking research.
They are indeed. One of their leading researchers, Dr. David Hansen, has been focusing on how AI can be used to analyze medical images, like X-rays and scans, to potentially detect diseases at an earlier stage. Early detection can be crucial for successful treatment, so this is an area with huge potential.
That's incredible. And it's not just about analyzing images, is it? The CSIRO report mentioned AI could be used in all sorts of areas, from personalized treatment plans to predicting potential health risks.
You're right. Think about a future where AI could analyze your medical history, lifestyle factors, and even genetic information to identify potential health risks before they even arise. This could lead to more preventative healthcare measures and ultimately help you take a more proactive approach to your health.
All of this sounds amazing, but I have to admit, all this talk of technology accessing my medical data makes me think about the potential risks. Data security is a huge concern these days.
And rightfully so. This is where the conversation about technological advancements in healthcare needs to go hand in hand with robust data security measures. We're talking about your most sensitive information, and protecting that needs to be a top priority.
Absolutely. The SOTI report actually highlighted that this is a major concern for healthcare professionals too, with nearly 40% citing data security as their biggest concern. What needs to be done to mitigate these risks and ensure patient data is protected?
It's a multifaceted challenge that requires a multi-layered approach. First and foremost, healthcare organizations need to prioritize investing in secure, modern IT infrastructure. Outdated systems are simply more vulnerable to cyber attacks and data breaches.
That makes sense, but it's not just about the technology itself, is it? You're absolutely right. It's about more than just the tech. It's about having, robust data protection laws and regulations in place and ensuring that healthcare professionals are well trained in cybersecurity best practices. We need to make sure everyone involved understands the importance of protecting your sensitive health information.
Exactly, and it's not just about preventing breaches. It's also about transparency and control. You should feel confident that your data is being handled responsibly and that you have a say in how it's used.
That makes sense. It sounds like there's a real need for open and honest conversations about these issues, not just within the healthcare sector, but with the public as well.
Absolutely. The more we talk about these challenges and opportunities, the better equipped we'll be to navigate this new landscape.
This entire conversation has been so eye-opening. We've gone from grappling with outdated systems to imagining a future where AI assists doctors and telehealth makes specialized care accessible from anywhere in Australia. It's incredible.
It really highlights the crossroads we're at with Australian healthcare. We
Yeah.
have this incredible opportunity to harness technology to improve patient care, make the system more efficient, and potentially revolutionize the way we approach our health.
You've given us a lot to think about today. What stood out to you as the most important takeaway from all of this research?
What fascinates me is the delicate balance we need to strike. On one hand, we have these incredible technological advancements that have the potential to transform healthcare for the better. On the other, we need to carefully consider the ethical implications, ensure robust data security, and never lose sight of the human element at the heart of healthcare.
Right. It's about utilizing technology to enhance the patient experience, not replace the vital connection between a patient and their healthcare provider.
Precisely. Technology should be a tool that empowers both patients and healthcare professionals to make the best decisions for better health outcomes.
This has been such an insightful deep dive into the future of Australian healthcare. Thank you so much for lending your expertise to this conversation.
It's been my pleasure.
And to all our listeners, we'd love to hear your thoughts on this. How do you feel about the integration of technology in Australian healthcare? Head over to our socials and let's keep this important conversation going. Until next time, happy diving.